Swadikap, good afternoon once again. Today is Wednesday, the 23rd of June, 2021, and this is the English language briefing of the daily press briefing, the English language summary of the daily press briefing here at the CCSA, as always. So firstly, thank you, Dr. Tui Sin. He, in his briefing, gave some details, in detail about the side effects of vaccines, also about the movements that we had concerning the various updates in various situations across the country, as well as the new initiatives, sports activities and the like, which I'll go into detail in due course. But firstly, for the benefit of the English language audience, I'm sure that you are very interested in the Phuket sandbox tourism scheme. So I'd just like to start off first by saying that yesterday, the Cabinet approved the Phuket Sandbox Tourism Scheme, which will see the reopening of Phuket Island from the 1st of July onwards. It'll also be followed by an additional trio of destinations in the Gulf of Thailand, popular tourist destinations in schemes along the same line. These are Got Samui, Got Phangan, Got Tau. That will be followed on the 15th of July. And which will allow fully vaccinated tourists from low-risk countries, as announced by the Ministry of Public Health, to travel to Phuket and these three other destinations without state quarantine requirements. So without quarantine requirements if you're fully vaccinated. And I'll go into details in that. So 1st of July is Phuket, and 15th of July is Samui, Phangan, and Got Tau, as per our reopening. So first, vaccination progress. Update on the number of vaccines that have been administered since the start of our vaccine drive. So yesterday, the 22nd of June, we have administered over 241,000 doses. This brings total 8.1 million doses so far. Our target for June, it's 10 million, as you know, so we're close to that already and hoping to achieve this goal within next week as planned. Now, all in all, over 8% of the entire population of Thailand have received their first dose with the first immunity coverage already, 8%. And over 3% have been fully vaccinated with 2 doses already. As for the statistics for today, we have new recoveries at 1,941. We have new confirmed case, as you see on screen, at 3,174. The total active cases still being under treatment, is 37,018. And in that number, 1,526 are in critical condition. Of course, this has an effect on the number of bed capacity, which I'll go into that also. And of this number, 433 are patients on ventilators. 51 new fatalities, making the accumulated total of fatalities in Thailand now at 1,744. Around half of that number, 51 fatalities recorded, half of that number were male and the other half female. And Bangkok still having the highest number of fatalities. On the overall situation, the number of new cases reported today is less than yesterday by more than 800 cases. However, more provinces have reported cases today, and the number of fatalities has reached a new high of 51, which is quite a worrying situation. The number of cases in Thailand remains at around 3,000 plus per day. 3,000 cases per day, with most of the cases located in Bangkok and its periphery, as well as the southern part of the country. So in terms of the provincial distribution, we have on screen now the top 10 provinces that reported COVID cases today. First, number 1, you have Bangkok, and then followed by provinces you see on screen, such as Samut Prakan, Samut Sakhon, Songkhla, Chonburi, and the rest. We continue to closely monitor the situation in parallel with the daily assessments on hospital capacity and the availability of beds, especially for patients in critical condition, because our priority is to save people's lives as well as the livelihood of the population as much as possible. The active case findings continue in areas at risk. In Bangkok, providing tests in 6 districts today. These 6 districts in Bangkok include ป้อมปราบศัตรูพ่ายบางซื่อมินบุรีสาทรทวีวัฒนา and Bang Khun Tien districts in Bangkok. The CCSA meeting this morning discussed the situation in the provinces which reported a higher number of cases and new clusters. And the majority of these are still found in factories. In addition, new clusters detected at a company which manufactures automotive parts in Pathum Thani. Also, a new cluster in a construction company in Samut Prakan and a military camp in Ratburi. Thus, it is imperative that we continue to keep our guard up. Now, I said that I was going to talk a little bit about Phuket, the Phuket sandbox, which was approved by the cabinet yesterday. So it was confirmed that it will open on the 1st of July. This plan will include also Samui, Phangan, and Koh Tao in Surat Thani that will follow suit on the 15th of July. Now, some of these requirements for those who wish to travel to Phuket under the scheme include that incoming tourists required to present the COEs upon arrival and register themselves on the website entrythailand.go.th. That's specifically for the Phuket scheme, and install the Thailand Plus so that the locations can be identified and they can be alerted on any case of local transmission while they are in Phuket. Number 2, they will also have to undergo the COVID test either at the airport or the hotel or at a checkpoint at their expense. And if the result comes back negative, they can travel anywhere on the island. Number 3, also will have to stay at a certified hotel. Now, this is called the Amazing Thailand Safety and Health Administration Plus, or SHA Plus. SHA Plus certified hotel for a minimum of 14 days staying at the hotel, but of course during the daytime you can travel all throughout Phuket. And of course this requirement for 14 days staying in the hotel at night and traveling within Phuket in the daytime, when you complete this already, you'll be allowed to travel to other provinces in Thailand. And the SHA Plus certified hotels are those which have passed the Health Ministry's control guidelines and those where at least 70% of their staff have already been fully vaccinated. So certified that the staff in these hotels are mostly fully vaccinated. In addition, the Phuket Provincial Authority has already set up a committee on immigration control to monitor foreign and domestic tourists entering and leaving the province. So ahead of the reopening of Phuket as a pilot destination, the governor has signed an order on the relaxation of measures in parallel with the government's announcement of general relaxation. So for Phuket in particular, effective on the 21st of June, certain premises were allowed to open, similar to the ones in Bangkok, but in line with the ones in the dark red zone. But of course, Phuket is in the yellow zone. So these include schools opening as usual, department stores, shopping centers operating as usual, restaurants open until 11 p.m., alcoholic beverages can be served, bars and pubs remain there, and the convenience stores and supermarkets are allowed to open as usual. Sports venues, beauty salons, snooker, billiard places, cinemas, and of course gathering of other activities must comply with the law. So all of this I mentioned is about Phuket, for Phuket. And also, I'd like to say that Dr. Thuisin also mentioned about an activity, a sports activity, which Thailand will be hosting. So as we continue to host these events, of course it will be under strict disease control measures. So during the 25th to the 27th of June, Thailand will be hosting the Beach Volleyball AVC Continental Cup after athletes from abroad have completed their organizational quarantine. This, of course, will be conducted with no spectators, no face-to-face physical spectators, and perhaps televised on television only. This is proof that we are doing our best to continue normal activities under a safe environment as much as possible. And you have on screen there just now some images, and this is about the division of the teams in terms of the competition that will be held on the 25th to the 27th of June. So on the left is the men's team, and on the right the women's team for the volleyball competition. Dr. Thuisin also answered some questions just now posed by media on social media. One is about the information, the news that we have heard about the critical state of beds, the number of beds available in Thailand, especially for those who are in critical condition. So his reply was that there are new options being explored and will be used and will be taken into effect. Firstly is the use of existing infrastructure or hospitals of the Bangkok Metropolitan Administration. So there are already existing infrastructure, existing facilities already. What has to be done is that they have to put in the equipment in order to function as an ICU facility in terms of ICU beds needed, for example. Another option, of course, is also to fill in these new state-run facilities with more beds, to fill them in with personnel from private hospitals. So that will be a collaboration that will be done. So just before closing, I'd just like to mention about another infographic from the World Health Organization on why elderly or having comorbidities should get the COVID-19 vaccine. Here are 5 reasons why those of you in this group are advised to get the vaccine as soon as possible. Number 1, because you are classified as a top priority group. Number 2, because protecting yourself means protecting your family and loved ones. Number 3, because vaccines that have received WHO emergency use listing are considered safe and effective. Number 4, because the longer the virus circulates among us, the more it will have a chance to mutate and decrease the effectiveness of current vaccines. And number five, because the vaccine is one more tool to help end the pandemic along with the various measures that we have announced already. So just a shout out. Firstly, I perhaps had not mentioned this before, but to the staff of international organizations and embassies. Now, these staff, maybe local staff or Thai staff, I'd just like to recognize your role in the importance of your role in providing information about the situation to the various international organization representatives or foreign embassies in Thailand. A lot of the information, the news may be more available in Thai, and I'm sure I've heard that many of you have made use of the briefing that we have today, either in Thai or in English. And many of you have used the Thai language information to report and to summarize to the various international organization representatives and embassies in Thailand. And they, in turn, are able to communicate to headquarters, communicate to the foreign expat community in Thailand of the current situation and what we are doing and how best we are trying very hard to address the situation of COVID despite all the odds. So hats off to you, the local staff of international organizations as well. We've received a lot of cooperation from many agencies. As you know, mostly we have information from the World Health Organization to end off our briefing. We also have had a lot of cooperation from other organizations as well in the United Nations, in the United Nations field, as well as many other embassies have been communicating well with the Ministry of Foreign Affairs on how to improve and develop new initiatives as well in terms of vaccines, in terms of all the things that we have to do to take care of foreign citizens in Thailand, as well as the Thai nationals living here. So thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศ